evening, and welcome back to another episode of Righteous Indignation TV News. I'm your host, Right Hypocrite. Well, you may recall I recently interviewed coronavirus, and the little bugger infected me. So, I got that hoax of a disease. So I was feeling pretty lousy for a number of days, but I got over it. Unfortunately, I seem to have given it to my mom. She's 66, and she died. But she was 66, so not many years left, really. And but anyway, as a result of all that, bother, um, now there's this thing that when I interview people here, I have two studios, and that's why we have this split screen. You'll see this split screen here. So I'm not close to any of the guests. So tonight, our guest is Dr. Nerd. He's an epidemiologist, and he's going to explain what epidemiology is for us. Please welcome Dr. Nerd.
Hello, Mr. Hypocrite. Thanks for having me on your show. Also, I really appreciate being distanced from you and using this split screen because I understand you had COVID and, hopefully you're not shedding anymore, but I don't really want to get it. I have to be really careful.
Yeah, okay, whatever. So, listen, I understand your full name is Dr. Phone Holster Pen Protector Nerd. So, how did you get that name?
Well, my grandfather was Dr. Pen Protector Nerd. He was, a good guy, scientist, researcher, and wore a pen protector. That was back in the, 60s, 70s. And then my father, his cell phones came along, so he and I he did, and I copy him, use a phone holster because, it's really efficient. You can whip out your phone. So my full name is Dr. Phone Holster Pen Protector Nerd.
Oh, okay. Well, that makes sense, I guess. I think I remember you from high school. Anyway, so speaking of high school and not seeing people for a long time, what all does it take for you to become an epidemiologist?
Well, in my case, I have a degree in medicine and then went on to do a PhD in epidemiology, which has a whole bunch of math and stats. And as part of that, I did a minor in production economics, but from a health point of view, looking at benefit cost analysis of health management systems.
What? You mean some of you guys do sort of have a vague idea about economics? Because we don't get that impression.
Oh yeah, we fully understand the recommendations we're making to reduce the spread of disease have a very serious impact on the economy. But our job is to tell you how to best address the biology to help stop the spread of disease. And we want to work with you to, how can we do that in a way that, minimizes negative side effects on the economy and people's mental health and that kind of stuff. Yeah, we're fully cognizant of all that stuff, but we have to address the biology.
Yeah. So, what is epidemiology anyway? I mean, I have to admit, before COVID, I never heard of epidemiology or epidemiologists.
Well, epidemiology is the study of diseases in populations. For your GP or your surgeon or your specialist of some sort, they look at you as an individual as the patient, whereas for epidemiologists, the population is the patient. The population in this region or city or country or whatever, what proportion of that population has sickness and what kind of sickness and what factors seem to be associated with that sickness that might be the cause. And so we're looking at the movement of disease through populations.
Okay, so That's why we need you in work helping out with pandemics.
Well, yeah, that's disease moving through populations of people around the world. So, think of it this way: if you need to have your car fixed, who do you go see?
Well, I go to a mechanic
And why is that?
because he studied a lot and fixed a lot of cars and knows what he's doing.
Yeah. So, if you need, heart surgery, who do you talk to?
Well, I go to a heart surgeon
And why is that?
because they've studied for years, the anatomy and physiology and pathophysiology and surgical techniques, and done it a lot, and they're really good at it. That's why I go to them.
Well, so when you have a problem of a disease moving through a population, maybe you should talk to somebody who's studied that kind of thing.
Yeah, I suppose. Anyway, so that's what epidemiologists do.
Yep.
And okay, well, that's it for tonight, folks. Thank you, Dr. Nerd. As you know, we're going to have Dr. Nerd on back to explain more to us about epidemiologists and epidemiology and the pandemic and what we can do. That's all for tonight. I'm your host, Right Hypocrite.